Small hernias could be easy or a difficult problem to solve. However, big hernias are big problems. One of the major disadvantages with big hernia is that there can be a lot of stuff outside the abdomen, and trying to put them inside the abdomen may lead to difficult and dangerous issues. Imagine putting in a 5 kg sugar in a 2 kg sack. It's not going to fit in, right? It's going to tear apart. That's exactly what happens when you're dealing with a big hernia. When we try to put in, well, there is no tear, but it leads to compromises in the function of the lung and the kidney, and they can rapidly fail, and this may lead even to disastrous complications such as death. Therefore, it is important to prevent this complication. Scientifically, we call it loss of domain, and the complication is called abdominal compartment syndrome. On a normal term, on a layman basis, let's just assume that this is a dangerous situation which must be prevented rather than treated, and therefore the techniques that are followed to treat these kind of hernias are to use preoperatively an injection which causes paralysis of the abdominal muscles with an injection called botulinum toxin, popularly known as Botox. Also, at times we can inflate the abdomen with artificial methods to make more room for the hernia to go in, a procedure called progressive pneumoperitoneum. And finally, intraoperatively, we can use techniques. One of them, which is commonly used in our center, is called the peritoneal flap method. So these are some of the ways of preventing it. It's important that if any patient has got a hernia with this entity called loss of domain, they should discuss these aspects of treatment with their treating surgeon. This is Dr. Sarfaraz Beg talking about loss of domain for hernia. Hope this helps. Thank you very much for your attention.